Hey guys, Dr. Tom Chaney here from Living Health Integrative Medicine, and in today's video I want to go over the numbers that you need to know if you're a type 2 diabetic or pre-diabetic, and really that's all of us. We really all need to know these numbers because right now it's estimated half the population is either type 2 diabetic or pre-diabetic, so we all need to stay on top of our numbers. So I want to go over the fasting blood sugar numbers. I want to go over the hemoglobin A1C. So fasting blood sugar, that is when typically the most common time to check that is right when you get up in the morning, with a pinprick. You can check your glucose, and that would be a fasting blood sugar reading. We'll go through those numbers. And then the hemoglobin A1C, so that's going to be a marker that you typically get run when you go in to see your doctor. It's a 3-month average of how well you're doing controlling your sugars. That's what that marker is looking at. It's looking at a percentage of red blood cells that have been damaged by high sugars, and that's what that percentage is looking at. So when you're checking your fasting blood sugar, less than 100, that is in normal range. That's where we want it to be. 100 to 125, that's when you're getting into blood sugar dysregulation. That's when the American Diabetic Association, they say, okay, you're in the pre-diabetic range or borderline diabetic range. And then above 125, now we're talking type 2 diabetes range. Okay, so we want to make sure we're seeing and getting on top of that ASAP to reverse that condition. So those are the ranges of the fasting blood sugar. Now I want to go to the hemoglobin A1C. So we want that marker to be below 5.7%. Below 5.7% is in a non-diabetic range. 5.7 to 6.4%, that's typically when they're going to say, okay, you're borderline, pre-diabetic range, and then 6.4, above 6.4%, you're in type 2 diabetic range. So, it may vary from provider to provider, but this is what the American Diabetic Association, these are their numbers, and you need to know these numbers. Really, the lower the A1C, the better. We know that more and more research is showing that, how damaging sugar is to the body. It's affecting every part of the body, so we want to keep your numbers low. But the first thing is you need to know your numbers, you need to stay on top of your numbers, watching those trends, and making sure you're taking some action as far as being on top of this to get them as low as possible. If you need help with that, then you need to contact me. I've helped many patients reverse this disease. I'd be happy to help you. So you can just check down below. You'll see my number. If you have any questions, go ahead and leave them down below as well. You can also, I'm the author of the book Defeat Diabetes. So you can also pick this book up. There's a lot of, there's 33 strategies in here that'll help you take control of your blood sugar. So I hope you got some great information out of that video, and I'll see you in the next video.